If your house is already on fire, if you don't calm that fire down, how good is that Wharton's jelly going to actually do? The body has innate intelligence, and it will do whatever it needs to protect itself. It's really about changing the tissue environment versus masking symptoms. There is no cookie cutter in regenerative medicine. It doesn't exist. You've got to do a very specific individual treatment plan based on their history, their medication, their tried and failed. This is a super high-level biologic therapies designed to reduce inflammation, immunomodulation, and support tissue repair. So when a patient asks you, well, what is regenerative medicine? That is a great, easy definition. And when you're looking at your clinical focus, it's really about changing the tissue environment versus masking symptoms. So patients are actually inquiring more and demanding different, which is fantastic. There is no cookie cutter in regenerative medicine. It doesn't exist. You've got to do a very specific individual treatment plan based on their history, their medication, their tried and failed. What stage of breakdown are they in? Are they a stage 1 or a stage 4 osteoarthritis? Because that will absolutely change what is your treatment protocol for this individual. All right, so PRP, this is super basic. So it is autologous platelet concentrate derived from the patient's blood. The main action is growth factor signaling, inflammation reduction. It supports tissue repair. Best use for PRP is mild to moderate osteoarthritis. There is a lot of data supporting tendinopathy and ligament injuries with your PRP. Some of the risk and contraindications, it's very low-level risk. It's coming from their own body. Some of the contraindications, an absolute contraindication for any blood product, whether it's PRP or A2M, is blood cancer. Any history of blood cancer, it is not recommended. And so you always have to look at the individual, their specific history. So blood cancer is definitely contraindication, and then they're definitely higher risk, potentially contraindicated if they have a platelet dysfunction disorder, severe thrombocytopenia, active infection, or active cancer. It's not recommended in those patients. And then I don't do it on my women that are pregnant. And I just say, you know what, when you're done breastfeeding and you've had the baby, let's talk. As far as clinical insight, you want to be looking at processing, dose, and placement, determine your outcomes. Processing. So important to have good technique. Good technique. Get the help, get the training that you need. Dosage. Whatever product you're using, if you're using since we're on PRP, a kit, please make sure it is 510K cleared. FDA 510K cleared, and get it in writing and reference it on the FDA's website. Concentration and dosage absolutely matters. Whether you are in a joint intra-articular, you are in a ligament or a tendon sheath, dose matters. So that's again where you have that specialized treatment plan for the individual. Also, are they an easy blood draw? Are they a hard blood draw? You know, these are all things you want to take into account when you're looking at dosage. And then of course, placement. Visual guidance is key. When you look at the research and articles, visually guided injections is now the standard of care. Everything from a legal standpoint is around, did that provider follow standard of care? That's what it boils down to. And so whether it's fluoroscopy, whether it's ultrasound, please use visualization with deployment of your whatever's in your syringe. I can't stress enough, so important. Because it does determine the outcome. Alpha-2 macroglobulin, it is made in the liver and it circulates, so it's autologous, it circulates in the serum. We also have very small amounts in the synovial fluid of our joints. But in the synovial fluid, it is not in a large enough amount to actually do a lot of stopping cartilage breakdown. So A2M, it is a protease inhibitor. It stops cartilage breakdown. So when you are slowing down cartilage breakdown, what is the patient going to experience? Less pain, Better function, more range of motion? Absolutely. It actually helps to neutralize cartilage degrading enzymes. And best use is mild to moderate. This is advanced osteoarthritis, depends on patient age, and it depends on comorbidities. If they're on a lot of medications, things like that. But definitely mild, moderate, really, really good for that. It's very low risk. Contraindications, it's a blood product, same as PRP. So this is step 1 in my protocol. And 4 weeks later, I do step 2, which is Wharton's jelly. It's an umbilical-derived extracellular matrix rich in cytokines and growth factors. The primary action is it helps modulate inflammation and signaling. Also, the signaling, you have your paracrine effect. Do you guys know what paracrine effect is? It's like an air traffic controller. I always think of it as like an air traffic controller of like telling what to go where and what to do. So your paracrine is communication signaling. It's bioactive communication signaling. And then scaffolding. Scaffolding is extracellular matrix. It's your fibrin. It's things that are actually creating support, scaffolding. And also helps to reorganize disrupted collagen. Do you guys know what type of collagen is in cartilage? Type 2. Yes. Wharton's jelly actually helps go in and reorganize type 2 collagen. And then you have your fibrin, extracellular matrix, and your growth factors, and all your signaling happening. It's this big orchestration of effort, is how I think about it. Best use, absolutely moderate and advanced degeneration. This is the go-to, for sure. So profile risk, it's moderate, mild moderate. Key considerations, it is an allogeneic source. Products do vary depending on where you are sourcing your products. Please just make sure do your homework on wherever you're getting your products, okay? Make sure you're following the traceability. You're getting your tissue report, independent third-party testing, sterility reports, good documentation, really important. Contraindications could be immunocompromised, potentially, if they have a history of a transplant or a transplant rejection. That's like a liver transplant. That's a kidney transplant. That's a major organ transplant. Extracellular vesicles involved in cell signaling its communication. That's the key with exosomes. It helps with immune modulation, and it helps downregulate inflammation. Unhealthy inflammation, it downregulates that inflammation. There's a lot of preclinical, investigational use, experimental use. A lot of providers are seeing phenomenal success with experimental use of exosomes, whether it's IV, whether it's nebulized. Those are all great ways to actually get the inflammation down on a cellular level, and then you can go in and put in whatever you're going to use, your PRP, your Wharton's jelly. If your house is already on fire, if you don't calm that fire down, how good is that Wharton's jelly going to actually do? The body is going to send it wherever it needs to because of the paracrine effect. If you have a lot of inflammation going on in the brain or the heart or the gut, leaky gut, how great is their knee going to do? The body has innate intelligence, and it will do whatever it needs to protect itself. All right, what are the risks in reality? Mild, moderate risk, concerns, regulatory exposure, product inconsistency. I go back to where are you getting your product? Do your homework on that. I've seen patients, even within a few hours, because you guys know I do a lot of injections at the end of the training. I can't tell you how many providers have come to me a couple hours later and they're like, I swear, I think it's in my head, I'm feeling better, I can move easier, whether it's a knee, a hip, a joint, a muscle. I think I'm losing it a little. No, that's real. This is very potent, very powerful, and that's what makes it so fun. Regenerative medicine is not a one-size-fits-all. Autologous therapies carry a lower risk. Everything requires diligence. I don't care if you're getting it from the patient's own body or to donate a product. everything requires diligence. Patient selection determines success. Best outcomes, proper diagnosis, appropriate biologic selection, that is which product, at what time, and frequency, because it does change for patients. And then skilled injection technique with precision, and ethical and compliant practice. That includes communication. I always joke, I say, don't promise rainbows and unicorns. They don't exist. You will see incredible things. However, you need to have proper expectations and communication set with patients.